Hi and welcome. I'm trying to learn medicine. Today, cataract. And after we've done that, we're going to do short impingement training. If you participate in short impingement training, it's at your own risk. And we're talking about internal anatomy and diseases of the eye. And this is no medical advice, we're just learning about it. Cataract. A cataract is a painless misting of the lens of the eye. Cataract often affects both eyes, or usually one more than the other. Most people over the age of 65 have some degree of cataract, but in the majority of cases it causes little or no inconvenience. Okay, there is some misting, so not good visibility, somewhere at the eye through the lens. It is painless, and by most people who have it, and by most of them over the age of 60, it causes only a little or no inconvenience, no problems. Symptoms. The vision, especially distant vision, becomes hazy or foggy, usually in one eye more than the other. Is it now for the people who have problems with it, or for everyone? Just if it's not that severe. The vision, especially distant vision, becomes hazy or foggy, usually in one eye more than the other. Close work, such as reading or sewing, is usually at first little affected. Okay, reading and close things doing are at the beginning not affected, but looking further away can appear a bit foggy, hazy fog. Duration. Cataracts will last until they are surgically removed. They cannot be cured by drops, tablets or spectacles, and they will not disappear naturally. Again, this book's from the 80s, I don't think here something's changed, but again. Some develop so slowly that they cause a little visual difficulty until the patient reaches the age of 80 or 90. Others develop steadily but slowly. And a few, for no known reason, get rapidly worse over a period of a few months. Okay, the only option to remove them is surgically, so to cut it off. Maybe there's something with an laser possibility. So. But oftentimes it develops only slowly over 20-30 years. It can also happen within a few months. Causes. The commonest cause is They say here that the commonest cause is advancing years. I would say that is not a cause. The blood supply which nourishes the lens becomes less efficient and the lens loses its transparency, it becomes opaque. That's the cause. So the blood supply which nourishes, so which delivers to the lens, becomes less efficient, so it doesn't work so good anymore, the blood supply, and the lens loses its transparency and becomes opaque. I don't know what opaque is, but I think that is the color. Whatever, it loses its transparency, so the lens gets worse because over the time the supply of blood gets worse. Other causes of cataract are diabetes and, rarely, the secondary effects of some eye diseases, for example, iritis, glaucoma, or detached retina. We still need to look at some place to esophagus and esophagus, but it's another story. We don't know the difference, maybe it's just spelling. But I think it was in this book, that there is somewhere in the beginning an anatomy part about the eye, so that you have clear what is no lens and retina and so on. Okay, it can be a part of other diseases, diabetes, iritis, glaucoma, detached retina. Treatment and the how. There are no simple treatments for cataract other than surgery, and this is better carried out late than early. This is because, while it is possible to retain useful and comfortable vision, even if one eye has a lens which is quite blind of cataract, it is uncomfortable and difficult to use with two eyes together when one has a lens in and the other does not. The time for treatment comes when the vision in the better eye deteriorates to the extent that normal activities and enjoyment are interfered with. This is because, while it is possible to retain useful and comfortable vision, even if one eye has a lens which is quite blind of cataract. Okay, vision is quite good even if one eye is affected, pretty strong. It is uncomfortable and difficult to use the two eyes together when one has a lens in and the other does not. We're talking of a lens which is naturally the lens of the eye. if surgery removes the lens, can we either see, comes the lens back, is it transplanted again in? I don't understand the treatment. The time for treatment comes when the vision in the eye deteriorates to the extent that normal activity, okay, whatever, by saying rather late than earlier, but this is no medical advice, this book is 40 years old, whatever. When to consult a doctor? If you have any difficulty in seeing, what the doctor might do, test your vision by asking you to look with each eye and turn at a card with lines or letters or figures of different sizes to find out how small a line of print you can read with each eye, with or without spectacles. Examine your eyes with an ophthalmoscope. If you have cataracts but the vision with one eye is still quite good, the doctor might say that nothing needs to be done and ask you to return if you notice the vision in the good eye getting worse, or arrange a check in 6 months or a year. He or she may refer you to an eye specialist who may also advise you to wait or return from time to time to review the situation. If the vision in the better eye is bad enough to interfere with your way of life, the eye specialist will probably suggest an operation to remove the cataract. After an operation, special spectacles or contact lenses need to be worn, and it may take a month or two to adjust fully. Prevention. Generally, cataracts cannot be prevented, but if diabetic patients allow their diabetes to get out of control, they may hasten to develop of eye complications. Okay, if a person has diabetes and they don't control the diabetes through insulin injections or something, then these cataracts develop very harshly. Outlook. Although cataracts usually occur as you or the person, human, gets older, only 15 patients out of every 1,000 over the age of 75 need to see a doctor about them, and only a few of these need an operation. When an operation is performed, the results are generally excellent. I don't get it. Is now the lens gone? Is now the eind? Do we mean now with a lens to, like glasses to run over the lens? Are the people now blind after the operation if they don't set the lens in? Or comes the lens in and after 1 or 2 runs it is ground firm and it stays in there and the people have adjusted to it? Or is it just, I don't get it. Maybe it's just a vocabulary missing. Are the people now blind with their eye? No, we're telling it differently. But what happens now? Do we need now a lens? Do we put the... Okay, but only 15, so only 1 promille, so 1 in 1,000 people, no, 10 in 1,000, 1%. 1% of people has a cataract which is more severe. Around 1%, and only of them a fraction, so around 1% of people has it more severe. And around 0.5% needs operation. The good question would be, why it is by some people then more? If almost everyone, let's say 80%, has it with the age of 70, why is it then only by 1% necessary to operate? If the cause is insufficient blood supply to the lens. Why is it then by some people necessary? And is there nothing possible to do about it? Just by the way, is there any way to bring to a targeted point oxygen? So basically, if there is insufficient blood supply to the eye, is there any second way to bring oxygen to the lens? I don't know, just there's a thing at the side, maybe it's not true, so maybe it's just a myth, but I once heard that people can also breathe a bit through the skin. I don't know if it's true. But just even if it's just 1%, is basically the idea is it somehow possible to target to injection, whatever, to very specifically bring oxygen to one place? Very broadly, any way at all. Is it in any way at all possible? Maybe it is possible directly to inject blood. Okay, that was the medical part. Now, if you were here for medicine, go directly to the next part of medicine. We will do now short impingement training. If you participate in stay in the short impingement training, then it's very good. Good is sent. And we know how it short circuits. I'm back. Up, around, down. and not backwards. Is it possible maybe to enlarge one blood vessel supplying blood to the lens? Because what is the difference between the 1% who need an operation and the 99% who don't need it? And the only obvious known reason is the insufficient blood supply. Next exercise, we're having long arms, strong fists, and we're going back with shoulders, high up, and in front, and down. Again, back, up, front, and down. Again, up. No, we're going up, back, down, front, back, down. How many people might wear glasses because they have cataract, but they actually think we have other types of eye diseases? Okay, next exercise. Let's need to exercise, we're behind time. I don't know what the next exercise. I know the accelerating motorcyclists in the knees, legs wide apart, hinge forward with a straight back, let the arms hang, and pinch the scanners together. Now make fists, let the arms and still pinch the scanners together. Knees, let the arms down, and again, shoulders together. Make fists, lift the arms up and still pinch the scanners together. Lift the arms down, shoulders, and now the sheet jumper into the knees, hinge forward, with the arm back, lift the arms in, make fists, turn the arms to the inside, lift the arms up and bring it together. Straighten up, bring the shoulders down, together. Knees, and the second round into the knees, hinge forward, with the round back, let the arms hang, make fists, bring the arms to the inside, lift the arms up and bring them together, straighten up, bring the shoulders down, together. And releasing. In the next exercise, we are having long arms, not with doing this. But the arms up and again down. If this exercise or any other one causes pain, then don't do it. And now the arms at the side, to the front, and the front, and back. And the third is down. Long arms, strong fists, shoulders down and together. Turn the arms to the inside, shoulders down and together. Arms to the outside, shoulders down, together. Arms together, shoulders down, together. Arms to the outside, shoulders down, together. Arms at the outside, arms at front, in front of the arms, with pronation, shoulders down, together. Arms to the outside, shoulders up in front. And arms in front, shoulders down, together. Arms back, shoulders up. And release. Now, arms together, a bit down to the outside. And together. And shrug. Lift the arms up, hug the shoulders up, and release all down. Again, up. Shoulders up. And down. Last time up. And down. And now, sunlight. Have the arm of the lower arm to the outside. Let something fall. Stop, go to your tennis ball level. Try to catch it again. And one last down the front, on the outside. And the stretching. Take one arm, bring it in front, the shoulders back and down. Pull the arm in, have flat fingers. Try to relax the arm, cup it back with the shoulder, then the palm of it up to the sky. The other arm in front, pull the arm and shoulders back and down, pull the arm and have flat fingers. Try to relax the arm, cup it back with the shoulder and turn the palm of it up to the sky. In the first parts of medicine, we did interventional cardiology, and one technique there is to revascularizate, I think it is called, the vessels again, start to make them free again. Is there any type of treatment which does this? I thank you very much, and until next time.